Next, we have Adalist-Estrin. Ann Adalist-Estrin is Director of the National Resource Center on Children and Families of the Incarcerated at the Family and Corrections Network in Philadelphia, and a child and family therapist in Jenkintown, Pennsylvania. Ann is also a trainer for Boston University Medical School / Healthy Steps for Young Children Pediatric Training Program. She is an author, speaker, and consultant to a variety of agencies serving children and families. Her seminar topics span a wide range of interests and ages and are popular internationally with parents and professionals alike. Her work has also included consultation to committees, government, non-government agencies, and communities of faith on developing plans for supporting children and families impacted by incarceration. Ann's publications include Mentoring Children of Prisoners, a curriculum for training mentors. Let me tell you what's going on. See, as they turn the lights down, they turn my light down too. So just so you understand here now. So I'm struggling here with this other, minus the light, I can't see you. You can see me, I can't see this stuff here either. Ann's publication include Mentoring Children of Prisoners, a curriculum for training mentors, Responding to Children and Families of Prisoners, a community guide, and the Children of Incarcerated Parents Library online at www.fcnet.work. We'll get that later. Since May of 2004, doing it again, Ann has used the Mentoring Children of Prisoners curriculum to train 107 community agencies in 46 states across America. Ann has held adjunct faculty positions at Temple University, University of the Arts, and Community College of Philadelphia. She teaches Those Left Behind, Addressing the Needs of Children of Incarcerated Parents, a graduate course for teachers for Bob Randall Associates of Gratz College in Philadelphia. Ann Adalist-Estrin, will you please come forward?
Thank you so much to everyone, to Andrew and to Bill for the introduction, to Andrew and Aileen for bringing me here to Connecticut, to this amazing event. It is amazing. And I am just so honored to be part of it, a statewide focus on children of the incarcerated. It isn't happening yet very much around the country, so pat yourselves on the back for that. But really, what I want to say before I go any further is the experts have spoken. The folks on that panel are truly the experts. The children, the young people, the incarcerated parents, the formerly incarcerated parents. And I tell people all the time that I have some expertise. I have expert knowledge about what's going on for children of the incarcerated around the country. But it's because of those experts and their stories. And it's their stories that we at the National Resource Center on Children and Families of the Incarcerated are committed to making sure are told around the country. So the experts have spoken, and the sort of the bones and the organs of this creation are in place. And it's sort of my job to put the flesh on it, to just put some skin around it from the national perspective. In case you haven't heard, the Pew study last year, 1 in 100 people in the US are locked up. What's incredibly significant about that is that it makes us the world's leading jailer, surpassing South Africa at the heart of apartheid. That should make us all enraged. Some of the other numbers that are important to talk about, and I want to talk about sort of why we keep talking about the numbers, but we guesstimate that 1.7 million minor children had a parent in prison in 2007, which was an 82% increase over 1991. That 1 in 43 kids in America has a parent in prison, 1 in 15 African-American children, and 1 in 42 Latino children, as compared to 1 in 100 or 111 or so of white children. And these are new statistics from the Sentencing Project. So we say, 809,800 parents incarcerated in the U.S. in state and federal prisons. Now remember, that's not municipal jails. And that roughly half or over half of them were parents. Now, this numbers thing, just keep in mind, for those of you that don't know and for those of you that know but need to be reminded, there are no systems in place in the United States to gather these numbers effectively and universally. As I said, the municipal statistics are often left off, so we're talking state and federal. The statistics are gathered through the incarcerated parent. That means they're gathered through the corrections side. And it's only within the last 5 years that correctional systems have begun asking those incarcerated about their families. And even so, it's still a rarity that a Department of Corrections or a state Department of Corrections or any individual facility will ask that routinely. The Bureau of Justice Statistics has gathered the data that we use and that you see. Remember what that meant. The feds sent people into prison and asked them about their kids. People that these people had no relationship with. They were from the federal government. Now, I know for a fact, having interviewed thousands and thousands of incarcerated parents and caregivers and children over my 31-year career, I know that lots of people don't tell the truth. Child support enforcement gets in the way, and no man should get out of prison with $100,000 in child support arrearages or anything close to that. And so if I'm a man in that circumstance, I might not admit that I have some kids. If I'm a woman, and one woman in Kansas told me this story several years ago, I lied and said I didn't have any children when they asked me. Because my children are being cared for by my sister, who has a different last name than I do and a different father, and we are telling everybody that she's my friend and not my sister, because in our state, she will be able to get some support and reimbursement if she's not related. Now, what was interesting was that she said, to me, it feels like a lesser lie to say I have no children than to call my sister a friend and not admit she's my blood. So there's all kinds of things. And by the way, I tell lots of stories when I speak, and no story do I ever tell that's an isolated example, just rest assured. The stories I tell are really stories that I've heard over and over and over again, so I've heard a version of that story many times. My point is that we are gathering these numbers from correctional facilities in a variety of ways, and they're still guesstimates, and they're still probably very, very low. The other important piece is that there is no system in place to gather the numbers from the child side, and as I think the panelists began to point out, maybe we shouldn't be. I mean, I don't think we should be collecting that information from schools or from the community yet, because we haven't yet made it safe enough to be asking families and kids about whether or not they have an incarcerated parent. So when we talk about the numbers, just know that they're guesstimates. But in any event, after many years of really struggling with this issue, it's finally dawning on the American public that this is an issue that affects a lot of children. And frankly, why do we have to keep finding out exactly how many? We know it's a lot, and that's probably the number one question that comes to us is, do you know exactly how many children there are in, West Podunk, such and such state? Why do we need to know that? We know that it affects a lot of children. So okay, again, between 7 and 10 million kids have had a parent incarcerated or under some form of correctional supervision, probation, parole, or incarceration, in their whole lifetime. Well, that's another huge number. And so what that illustrates is, and again, the panel was so expert at illustrating this, it's not just the incarceration, it's all of it. It's what happens when they get out. It's what happens to mend that relationship. Just because, so just to measure how many children have a parent currently locked up isn't enough. A little bit more of what we know is that 86% of the minor children in the BJS studies were under 10, and 22% were under 5. And I'm going to come back to this statistic a little bit later. But finally, we are looking at policy issues related to children and families of the incarcerated. And the Council of State Governments just in October released Incarcerated Parents, an action plan for federal policymakers, and we're calling it the Pathways to Change. This is just the beginning of being able to say, after interviewing lots of families and lots of experts, both experts who are the people directly impacted and those that are sharing that information as experts in their writing and research, the Council of State Governments has issued these sets of recommendations. And I'm going to talk about those for a little bit. I'm going to talk about what the recommendations, I'm going to highlight what the recommendations were saying, but I'm also going to follow that up with some commentary based on focus groups that we at the National Resource Center held in conjunction with the Council of State Governments recommendations. And we held the focus groups in California, Texas, Arkansas, Illinois, Pennsylvania, and New Jersey. And they were focus groups of children of the incarcerated, adult children, formerly incarcerated parents, and caregivers, and some service delivery practitioners. So one of the highlights is the need to collect more data. It is on everybody's top 10 list. One of the things that we want to emphasize, though, is that creating the incentives to encourage effective information sharing and gathering of information is only a part of it. It has to be accompanied by guidelines for how to collect that data, collect those data, because of what I said earlier. If we're going to be accurate, then we really need to build this issue of trust. Trusted adult means trusted others as well. The people gathering the information in some way have to be trusted by the people being asked the questions, or we're not going to get accurate information. And folks have to be assured that by and large, with as few exceptions as possible, this information will not be used in any way to hurt them. It won't be used as a stick or a carrot. It's not going to be used to say, okay, so you have all these kids, so if you do all of these things, you can have these extra services. Or it's not going to be used to say, now we are going to be sure that we are not going to let you visit because you had 2 children whose rights were terminated. Or, the fearfulness that folks have about how it's going to be used has to be allayed. The other issue is that we're always being asked, how do we identify the children if we indeed start looking at service delivery models? And we always say, well, identifying is one way to phrase it, but if you build it well, they'll identify themselves is another way. And trying to out people when they want to stay hidden is not a great way to build trust. Rachel Condry, in her book Family Shame, says that relatives feel forced to hide from the shaming gaze of others, leading them to withhold information and avoid connections that may help them. And I want to address the question that was asked earlier, because there's 1,000 ways to hide. And one of them is to cover your shame and your feelings and your issues with false bravado and a sense that you're proud of the people that are incarcerated. I loved what Frankie said was that if it's the only song you got to sing, you're going to sing it with pride. And until we give our young people a different message and stop telling them that they're more likely than their peers to go to prison, that's the only song they have to sing. It's part of their identity. And it is, in my view, another way of hiding. So another recommendation from the Council of State Governments is to research more and more and more and more about the impact. How do we really get at some studies that tell us what is the impact on children? By the way, we don't have any. We really don't. We're beginning to get researchers to take a look at this, but the studies we rely on, by and large, are studies with really marginal or just non-effective population size, not solid outcome measurements, and so, or the sort of famous Murray and Farrington study that a lot of people use to talk about the impact, which was done in the United Kingdom with children, I believe, that were born in the early 1960s. And so, until we really have studies about our kids in our social environments that look at them over time and also take a look at the variations in family and caregiver supports and situations, and not only, for instance, look at children in child welfare systems. If we're only going to look at the children in child welfare and say that that's an adequate sampling of children of the incarcerated, we're really missing a whole lot of kids. The other issue for me is looking at all of this in a broader context. Because I do teach pediatricians at Boston University Medical School, and that's going to get woven in here quite a bit. The brain development research, the neuroscience that we are now able to access, the issues of trauma research and attachment theory have not been applied to this population at all. And until we really start to pay attention to this and stop just saying that these kids are going to turn out just like their parents, and as one of the panelists said, stick them on medication and try to help them through, until we really pay more attention to a broader context of the knowledge base, the literature out there on the literature that's applied to other children, and that's important. What we see and what I believe is that children of the incarcerated are not one monolithic group of kids. They're just not. So are these guys exceptions to the rule? Not really. I've interviewed 16,000 children of the incarcerated in my 31 years. They're very similar to these stories in all of their variations. Now, if we caught any of these people on our panel today 5 years ago, we might have heard something different. And so some of the young people and children I talk to are at one place now, and then when we talk to them later, they're at a different place. But the variations are really critical, because on the one end of the continuum, we've got kids with layers and layers and layers of risk factors in their lives that are so complicated to get through. On the other end, we have kids who have lots of protective factors in addition to the risk factors, but they also may have fewer risk factors, but that the incarceration of that parent was the risk factor that really tipped the scales for them. So really looking at the continuum of need and looking at not only what are those quote-unquote risk factors, but really looking at the protective factors. Former Surgeon General David Satcher says, risk factors are not predictive factors because of protective factors. And we still haven't done a good enough job of really saying, what are the strengths for this child and this family, and where can we build? Another recommendation in the CSG report was the need to evaluate programs, of course, because, every third word out of all of our mouths is evidence-based practice. And so we do have to be more effective and more consistent at evaluating all of the services we're saying work and all of the services that we're predicting and projecting to put into place. However, the effects of unconscious bias and attitudes on policy and practice as relates to evaluation is something I want to note and have you think about. Mentoring children and prisoners programs are alive and well, and they really have been amazingly helpful at bringing the story to the public forefront. And many of them are really effective, not only at providing protective factors to kids, but also at doing some really good community action work. It is the only major federally funded initiative focused on children of the incarcerated in the history of the U.S. So, of course, it's going to be evaluated. And it's going to probably show, when all the evaluations are finished, that it's a helpful initiative. All right. So what is that going to mean? Depending on the whims in Washington at the moment, it could mean that they're just all going to get refunded, that we're going to have this amazing amount of focus on mentoring children of prisoners programs. But what if we also put that much money and effort and energy and passion toward visiting programs, toward transportation and visiting, toward full-out connecting children with their parent programs, and evaluated those? And then we could compare the evaluations of the connecting the parent programs with the mentoring programs and see. But if we only do one and it shows positive, and then we continue to focus our energies and money there, we could be ignoring some real needs of the kids and families. Some additional research recommendations that came from the focus groups and the families was to evaluate the potential for research protocols that inadvertently cause harm. And some of the examples were questions like, do you ever wish you had a different parent? Parents in the focus group said that that was a question on the HHS Mentoring Children of Prisoners evaluation form. And the family member said, who hasn't wished at some point in their life that they've had a different parent? But the meaning of answering that question, yes, if you're a Yale graduate student with two parents who are CEOs of major companies, is very different than if you are a child with an incarcerated parent at any strata socioeconomically. The meaning that's going to be made if you answer the question if your parent is incarcerated, yes, I wish I had another parent, is very different than the meaning that's made for other kids. And so there are questions that really need to not be part of research protocols. Have you ever seen your parent use drugs? Has your child's caregiver ever been incarcerated? And so these are the kinds of questions that family members are saying increase stigma and shame and make it very, very, very difficult. So additionally, they suggest that we have to take a look at, the evaluation of training on some of these programs. Many, many initiatives are funded, and folks do not have adequate training, and the resources for training are not available, and so that the training that a lot of the Second Chance Act grantees are going to be getting, a lot of the Mentoring Children of Prisoner program grantees are going to be getting, it's the best they can get with the funding they got for training. And until we evaluate training, it won't get to the top of the priority list. Conducting research on the unique challenges of caregivers, boy, our caregivers are really getting the short shrift in all of this. Most of them say, now these are caregivers that are not associated with child welfare or child protective services, but most of them say, the programs get funded for the kids, and when we say, what about us? People say, we have to focus on the child, sorry. Conducting studies, not yet done, but several in the wings, on the presence and role of trauma, stigma, and shame. We are saying it all the time, but there aren't any studies that are actually helping to support that. Another highlight is of the CSG report is to coordinate across service systems, meaning that child welfare talks to corrections and corrections talks to child welfare. Well, here's what the focus group family said. Really? We're really wary of this. Not only are we wary of it, we want to know, what are you going to do if you're talking to each other about us? And what about communicating cross systems between the systems and us, the families? Could we be told when our loved ones are being moved from one facility to another? Could we be told that one facility in the same state has a regulation about wearing green to visits, but another facility in the same state, you can wear green, but you can't wear denim? Could we be told some of this? And that while the Council of State Governments recommendations speak and say specifically that there are resources out there nationally for caregivers, the caregivers all said, where? So the obstacles and pathways, the other big issue that was raised by the panel, and I want to keep talking about it, is enhancing the capacity of other child-serving systems to meet the needs of the children of the incarcerated. You know, we focus on child welfare. Important to do that. We focus on corrections. Really important to do that. We have not really done a good enough job of looking at education, health, and mental health as those systems that are serving children big time, that really need training and support to combat the bias and to combat the judgments that are often made. Two that come to mind, pediatric training would suggest, and pediatricians and pediatric healthcare providers all the time, once they're told, the caregiver finally gets up the guts to say, you know, my child visits, I take him to visit his dad, or his grandmom takes him to visit his dad in the prison. Oh my God, well, you know, those places are full of TB. But when pediatricians are trained to say, that's terrific, because the attachment building is important to child development. And I'm so glad that you told me, because I would like to test her twice a year for TB. Totally different responses. Teachers all the time will say, when kids come in Monday morning after visiting a parent in divorce, okay, was with dad this weekend, I can tell, or switched houses, this was the switch week. Never would they say they should never let that child see his dad. Never. They just, you know, they might say, I wish they could get it together better, or I hate this, you know, in my day people didn't live in 2 or 3 houses. But they would never suggest that the child shouldn't see their parent because their parents were divorced. But if the same child comes in with Monday morning meltdown and they visited their parent in prison, very often teachers will suggest, you know, I'm not sure it's such a good idea for your child to visit. So until we kind of try to really work with those systems that are really the backdrop and the fiber of kids' lives, you know, the caregiver that wants to say he's dead, as Trevor talked about his mom saying, could be on the fence. Okay, I'd like to say that he's dead, but I know that he really needs contact with his dad, so I don't know. I mean, he's not in my life anymore, and I don't want anything to do with him, but I'm on the fence. A pediatrician saying that's not a good idea, or a teacher saying that's not a good idea, will flip some of those caregivers over to the side of saying, that's it, we're done, no more contact. The CSG report talks about establishing task forces at state and federal levels, and I'm going to suggest at local levels as well. And this meeting here is a prime example of bringing folks together, cross-service systems, cross-disciplines, and taking this information back to, you know, the all politics are local, to your communities. Another category in the CSG report is support for caregivers. Establishing a federal policy that would permit kinship care agencies to serve families that are not in the child welfare system. Identify promising examples of kinship navigator programs. And of course, this sort of overwhelming need to analyze the impact of the Adoption and Safe Families Act. To really consider parental incarceration in the clock running. Issues about financial barriers for caregivers, of course, are big in the CSG report, stuff for us to consider as we talk about practical applications here in Connecticut. To reach consensus, the report says, so that incarceration is not considered voluntary unemployment or abandonment, and streamline the review and adjustment process for modification of child support orders. That seems to be popular in most states, and we're starting to see changes. Actually, one state is now, I think it's Texas, and Michigan maybe too, are looking at child support amount based on the dollar amount that's being earned in prison, which is the average nationally is 42 cents an hour, I think. Other financial barriers for parents and caregivers have to do with state benefits and federal benefits, the statutory bans that disqualify individuals, and most of you know this, restoration of eligibility upon release, and enrollment of individuals who did not previously receive benefits. These are things that are getting in the way of adequately supporting children of the incarcerated. So then the next category is about minimizing trauma. Responses during arrest. Some of the panelists talked about witnessing arrests and some didn't. This is a very popular initiative around the country because of the Bill of Rights for Children of the Incarcerated that comes out of the San Francisco partnership. I'm going to talk about that again in a minute. But the arrest protocols are starting to become very popular. It doesn't require legislation so that departments of law enforcement divisions can, and police departments can adopt the idea of having a protocol for what to do when you arrest a child's parent. But again, what the focus group said was that most of these protocols are talking about child placement. They mostly include, do you allow the parent a second phone call? Do you allow, are the police officers going to really listen to the parent when they say, I want my children to go to so-and-so when they're arresting that parent? What the focus group parents and families and kids said was they're less concerned about the child placement issues as they are about the fact that so often children are interrogated at the time of the arrest about their parents' drug use or habits. And the one that I am very familiar with because of the children's trauma is property being destroyed in front of the children, and usually children's property. Stuffed animals being ripped open looking for drugs. One adolescent talked about having every one of her CDs broken in front of her. And she said, I didn't think you could hide drugs in a CD. What was that about? And so the focus groups were really talking a lot about the issue of understanding the impact that this arrest is going to have on children. And of course, the first priority is protecting everyone there and protecting the integrity of the arrest, and I understand that. But are there ways to combine those needs of the law enforcement organizations with the needs of children? And also, we forget about the children that aren't home, the latchkey kids that are coming home to an empty home because that parent, whether it was a primary caregiver parent or not, that parent was supposed to be there. Other minimizing trauma issues, parent-child interactions within corrections, engaging courts to help reduce trauma by not sending parents so far away, emphasizing the role of corrections in developing family-strengthening visiting policies. That came up so much on the panel. It comes up everywhere I go. Do we have to have non-contact visits? Do we have to be able to, not touch or not, young children not sit next to their parent? What is necessary for safety and what could be adapted in the best interest of kids? The focus groups talked a lot about the Council of State Governments' recommendation to provide parenting programs, and I was thrilled that one of the questions was about that here in Connecticut, because the focus groups all talked about how the parenting classes most of their loved ones were getting were totally irrelevant. That, when are you going to talk about nutrition for kids when they're probably not going to be living with them or feeding them? But talk about what they should expect from the child's emotional roller coaster when they get out, or from a visit, or as was mentioned, I think Megan mentioned, this issue of what the heck do we talk about in these visits? There's a video we use often in training called Shadows that we have on our website. And Suzette is one of the caregivers in the video, and she says, the kids will say, there's nothing to say. And she says in the video, and I ask myself, is there really nothing to say? Or is there too much to say? Because the real issue is that kids have so much to say, but do not feel like it's appropriate or they worry about saying it. The other thing about the parenting programs that's important is the issue that Caregivers say all the time, they learn all this stuff in parenting class and then they tell me I'm supposed to do it. And connecting what's happening in parenting programs with the caregivers, I know that several organizations around the country, the Osborne Association in New York and Centerforce in California, have concurrent programs for the caregivers in the community where they're really learning the same things. Another minimizing trauma issue for me is about language we use. And so this comes from the CSG report to promote promising practices of state and local corrections, child protection, and community agencies to eliminate barriers to contact and to build appropriate programs, blah, blah, blah. But the red is important. To facilitate healthy parent-child contact. We all want that. This is what the caregivers and the kids said. Who defines healthy? Because if the caregivers are angry at the incarcerated parent, their definition of healthy might not be the same as the child's, the incarcerated parent's, or an outside professional. On the other hand, service providers who are very biased about incarcerated parents, their assessment of healthy might really not be accurate because it may be clouded by their own, what we call ghosts. More implications: evaluate parent-child programs and policies to determine not only how many people have a demonstrated need, but also outcomes for program participants. I want to give an example. The Cook County Jail in Illinois was the first correctional facility in the country to get funded by a public foundation. It's the Johnson & Johnson Foundation, Bright Horizons, that funds child care centers in things like homeless shelters and AIDS and HIV clinics. And they funded an incredibly developmentally appropriate visiting program in the Cook County Jail. I visited it. It is amazing. It is beautiful. It looks like the best daycare center you would ever want to take your child to, with a school-age nook and rocking chairs. But when I asked them how many women get to use it, they said, well, we can only open it on Saturdays, not on Sundays, because of our staffing issues. And you have to, the women have to jump through a lot of hoops in order to use this program. And so, excuse me, on any given Saturday, we may get 4 or 5 women using it. So it's so important not just to talk about program design, but to really dig in and find out what does it take to really get it used. More promoting promising practices. This is all in the CSG report, by the way, so you can see it's really comprehensive. But initiating efforts to identify promising program models and effective evidence-based practices, develop consistent set of outcome measures. That's recommended. Again, what are some of the issues that get raised in our focus groups? Difficulty in calling some of this evidence-based practice. Evidence of what? Sounds like a silly question, but nobody can decide. Is it evidence of recidivism prevention? Evidence of school performance increase? Short-term versus long-term outcomes? I want to say that, you know, I've been doing this so long that so many of the young people, as Frankie talked about, have themselves ended up involved in prison and get out and are fine. If we only say, let's keep them out of prison, we're not really looking at long-term, measurable long-term outcomes that are effective. You know, the ACE study, the Adverse Childhood Experiences study, talks about and puts parental incarceration as one of the factors creating long-term health problems, including higher rates of cancer and diabetes. But that's not going to show up in any short-term evaluation. If we use school performance as a measure, come on, you know our schools are failing a lot of our kids. And so is it because their parent was incarcerated that they weren't doing well in school, or because the school, as one school in Philadelphia, one young person told me recently, they don't give us homework. In fact, the teachers say, you know, you kids aren't going to amount to anything anyway. I've heard that story at least a dozen times this year, and it's only the 1st of February. So we can't use school performance as an outcome measure unless we control for the school. Focusing on recidivism prevention, my goodness, we've got enough corrections people here to know that an awful lot has to be in place, not just a good service to the children to have recidivism work, to reduce recidivism. So looking at multi-pronged intervention strategies where services to the children are in conjunction with reentry programs that are effective, and by the way, reentry begins the minute the person goes in. And then let's not forget about structural racism. We cannot ignore the fact that there are practices and principles at work that are racist fundamentally in the work that some of us are doing, and we encounter it all the time. Recommending that the National Institute of Corrections provide cross-training for corrections staff. This came from the focus group, not from CSG, because until correctional staff have some training about child development and about parent-child relationships, a lot of these programs either are ending and they're not being allowed to continue, or they're not as effective as they could be because the correctional staff, who are overworked and underpaid and struggling, as one correctional officer said to me in a focus group, you know, my wife doesn't get parenting classes for free. We don't get child care services or a beautiful playroom to play in with our kids. Why should we support this for them? So let's go back to some data conflict issues in all of this. If 86% of prisoners' children are under 10 and 22 are under 5, and the largest federal funding initiative is mentoring children and prisoners, targeting children 8 and over, although 4 to 8 are allowed, but most programs in the country are 8 to 16, we have some little bit of a disconnect here. If 92% of the prison inmates are male and 8% are female, given that, and that means most of the children have incarcerated fathers, given, of course, that the number of incarcerated females is increasing exponentially all the time, and that most of the mothers were primary caregiver parents, most of the fathers were not, understanding that, it's still a smaller number. So the dilemma in advocacy is gender-specific initiatives, like let's really look at programs that suit moms and suit fathers, versus the low-hanging fruit. What I mean by that is everybody wants to call it a maternal child health issue. The American Public Health Conference asked me to come and speak at it this year about this real issue of maternal child health concern. Okay, it is, but it's also a concern about children and their fathers. And yet most mentoring children and prisoners programs in the country go to female prisons to ask about their children. And when I ask, why aren't you looking for the children of incarcerated fathers, especially if you want to get your numbers up, they say, well, it's just easier to get to the kids through the mothers than it is through the fathers. So I want to talk about what we at the Resource Center talk about, the M&Ms. I was so thrilled listening to the panel talk about this, because most of the kids I talk to and the adults I talk to are either making a new relationship because incarceration is presenting them with the opportunity to build a relationship, or they're mending a relationship that was pained. I don't want to say broken because it's not always broken, sometimes, but it's pained, it's hurt, it's strained, it's stressed, needs healing. Or they're maintaining a relationship that was good. And there are children of the incarcerated out there that are maintaining decent relationships with their incarcerated parents through tremendous obstacles. There's not one child that I've spoken to that isn't doing one of these three things. As one young woman, I interviewed folks for our new website, IT professionals, about a year and a half ago, and I was interviewing this one young African-American woman starting her own company, and she was looking at our website and tears were streaming down her face, and I said, I know this website's really bad, but it's not that bad, right? And she said, no, that's not it. I'm looking at this material, and my father was locked up most of my life. And I never talked about it. And I said, how did you cope? And she said, well, I coped by picturing a dad that was going to get out of prison and come home and take care of me, and we were going to fix it, everything, and he was going to buy me a red bike. And she said, when I got older, it was going to be a red Corvette. And I looked out the window in my parking lot, and there was a red Corvette. And I said, is that yours? And she said, yeah, I bought it for myself. And she said, but then my dad got out of prison, and he's doing really well, and he's helping me make the car payments. This is a woman who was struggling with making or mending or maintaining relationships her whole life and never talked about it and was unknown to any public system. Now, what we end up funding and focusing on, by and large, across the country, are programs that help children manage in the absence of that relationship. And if they're struggling with making, mending, and maintaining, and we're focused on managing, sometimes that's a disconnect. So I want us to think about the fact that funding initiatives to focus on helping children to manage is fine, but it needs to be challenged. What about programs that help them make, mend, and maintain as well? Mentoring is a popular program focus. We need to evaluate whether mentoring is better than visiting and connecting programs. And mentoring helps children 8 to 14 with moderate risk, so we need to connect what we're doing to the realities of the numbers for kids. So what does that mean? If most of the children are very young, what do we need to create to help make, mend, maintain, or manage? And embedded in all of this are the fundamental issues that were not addressed by the Council of State Governments report. The Ds, the discrepancies in sentencing, the disproportional representation of people of color in the criminal justice system and in the child welfare system, the disparities in health care. The drug addiction and treatment issues, trauma is not adequately addressed, and the baseline issue of mass incarceration that were not addressed in this report. And so they say they shouldn't have been. So okay, so now it's time to take these embedded issues and overlay them on those recommendations. Other emerging issues, as I mentioned, caregiver support. Mothers are caregivers too. The mothers of children of the incarcerated who are not getting public assistance of any kind are not the ones that are talked about when we talk about caregivers, and they're angry. They want to know, where are we in this discussion? We're not grandparent caregivers, we're not foster parents, we're not kinship caregivers. And so we need to really pay attention to that. Juvenile versus adult corrections. 31 years I've been doing this work, and ne'er the twain should meet. We talk about juvenile corrections, we talk about adult corrections. We're now beginning to say they have to talk to each other, we have to look at policies and practices that fit for both. By the way, Chauncey, this is in no means, I hope that you'll understand my taking up your statement. The 7 to 10 times more likely statistic doesn't exist. What did exist was a study, I believe it was from Florida, in the late 1980s, that 70% of children in the juvenile justice system had an incarcerated parent at some point in their life. And it was misinterpreted data. And now we're seeing that statistic everywhere because it was misspoken in the Senate confirmation hearings for the Mentoring Children of Prisoners initiative. And so it's really important that we understand, all of us know, that kids can end up in the juvenile system when their parent is in the adult system. We all know that. But we also have to recognize the reasons why, and the reasons why are not because they're imitating their parent. I also want to talk about immigration and corrections, which is those two systems are juxtaposed all the time. I have a young woman who's going to participate in a panel for us next week from California who says, is it okay for me to talk about the double whammy? And I said, what's that? And she said, being Mexican-American and having an incarcerated parent. And everybody wants to ask me right away, are you illegal? And so is that, how do we address those issues? Universal versus targeted outreach is an issue to continue to focus on. When we talk about interventions in schools or in communities, we have to stop saying, let's just look at these zip codes. We have to say, if a school district sends home information to the entire district about having an incarcerated parent is hurtful to children, and we are now going to provide support groups in the school, or maybe just an informational note home that our library, and in this school district, all of our libraries are now going to include 3 new books written about children of the incarcerated, or we're going to have an artist in residence program of someone a formerly incarcerated person who's written a book for children. So any kind of informational stuff that's universally targeted. Advertising services and programs in supermarkets and in drugstores and public libraries, instead of just going to the places where the families at that one end of the continuum I talked about would be, but not all the other families. We're starting to see this trend of wanting to call children of the incarcerated homeless, because then they can get services in the schools, and the kids again say, I have a home, I'm not homeless. It may not be the home that my mom and dad lived in, but it's my aunt's home, and it's a home. People want attention paid to the issue, and so we say things like break the intergenerational cycle of crime and incarceration and give a forgotten or invisible group of children a chance to reach their highest potential. Nothing wrong with that, I guess. Randall Robinson talks about this in his book about slavery, but this quote fits. It's distorted in the telling and buried in the untelling. This is an adaptation of a website for a mentoring program that talks about Joe R., 58, and his son Joe R. Jr., 36, and his son Jimmy R., this intergenerational cycle. Another initiative, the Girl Scouts Beyond Bars, which is a terrific initiative. It's very effective. And Women Make Movies made a film, Troop 1500. Many of you may have seen it. On the box, it says that their mothers are prostitutes and drug addicts, but they want better. And the kids in the focus group at the screening said, can we show the film without showing the box? So we need to pay attention that when we keep saying these things and keep talking about the intergenerational cycle without saying that the children live with the same risk factors that their families did, that many of these kids have the trauma of separation from their parents, and not just have the folks out there assume that what we're saying is they're learning criminal behavior from their parents, and that's what the cycle is. I can now say that Susie Jensen said this. She said it 3 years ago in a panel for us, and I always change the demographics, and sometimes it's from Connecticut, sometimes it's from Arizona, sometimes it's a boy, because I didn't have her permission. But this Susie Jensen from our panel earlier said, if we're at risk for following in our parents' footsteps, perhaps it is because you say we are. These are children that are better off without their parents. Not true. That's what we hear. We hear that these are children that lack affection and guidance. Former President Bush said that on an Essence magazine mentoring video. He said, these are children that lack affection and guidance. Some do. Most don't. And most of them didn't even live with their parents. Well, the BJS statistics said that 44% and 55% of the fathers, that's state and federal, lived with them within 2 years before their incarceration at some point. So, and for women it's much higher, but to say that they didn't live with them is really just dismissing it. So what if they didn't live with them? They may have had a really significant relationship, and by the way, the relationship is defined by the children. So if children feel like 3 times a year phone calls and visits once a year is a solid enough relationship for them that the incarceration of that parent could cause trauma for them, we need to listen to that. Probably the most important statistic in this whole presentation is that 2/3 of the incarcerated parent population is non-white. 2/3. Vince Schiraldi, who's the head of the Juvenile Justice Division of Washington, D.C., said, Think of these children as you would your own, but never forget that they're not. And if they were yours, you would not focus on the floor of crimelessness as the ceiling. And it's harder for some to think of them as their own when they're mostly black and brown. That statement says a lot about how we approach children of the incarcerated and the role that structural and sometimes interpersonal racism plays in this process. So we need to stop saying this because it further stigmatizes kids. But I want to get to this quickly before we run out of time. The attachment literature says clearly that attaching children with their parents buffers them from hardship. Researchers and clinicians utilize attachment research to guide family strengthening program and policy development all the time. So let's examine the cycle. There are 3 times when the government separates children from their parents. One is child abuse and neglect, and child welfare supports go into place based on the notion that attachments are important to buffer children, and primary attachments are to parents. So everything goes into place to attempt to keep children connected to their parents because the attachment literature tells us without a doubt that that's important to do. If it doesn't work, it doesn't work. But the attempt is made in every child welfare system in America. Military deployment. My younger daughter is serving in the Navy, and she gave birth to my first grandchild this year. She got so much stuff. If you get deployed, if your husband gets deployed, attachment is important. Children need this, children need that. Incarceration, nothing. There's no system that sends caregivers information that says, here's a good way to deal with this. Here's what you should tell your kids. Here's criteria for judging whether or not kids should visit their parent. Nothing, except from private agencies. So trauma, which is the perceived danger that excretes cortisol into the brain, we know causes changes in brain architecture, and we've been paying attention to it a lot because of sexual abuse and violence, domestic violence and community violence. We also need to remember that the cortisol levels are mitigated by dopamine excretion. Dopamine excretion is the chemical after the danger is over. This is important. We as adults get dopamine excretions when we have sex, when we eat good stuff, when we see people that we love after a long absence. It's the well-being chemical. Young children get the well-being chemical, by and large, from their primary attachments. So if we separate children from their primary dopamine excretion purveyors at the same time as causing them the trauma of separation, children are going to be negatively impacted. And the positive cycle would be trauma, cortisol, attachment, dopamine, recovery, reinforcement, resilience. Primary attachment figures provide the buffer, and the separation from them causes trauma. These 2 reasons are why every effort for this large group of children that are under 8 to connect them with their incarcerated parent in a way that fits with the family, in a way that fits with the structure when there's no legal barriers to it, every effort should be made to keep these children attached to their parents, because these significant attachment figures are the buffers from the negative impact of trauma. Toxic stress is unrelenting stress, negative influences in life without the buffer of the primary attachment figures. And think about the toxic stress levels in families involved in the criminal justice system at every point. In the arrest, the pretrial, the sentencing, the incarceration, stage 2 when you get kind of used to it, the pre-release anxiety, and the post-release ambivalence and chaos. This is what the architecture change in the brain causes. Impulse control changes, cause and effect changes, predictability, emotional regulation, and reciprocal engagement. We know this now because of the invention of PET scans. We know that the brain architecture is changed by trauma, and the changes create impulsive acting out behavior combined with the feelings that our panelists talked about are going to get these kids in trouble in school. The number one predictor we do know of incarceration is school dropout rates. All of this fits together in a way that says there's so many things we still need to do to avert the negative cycle of trauma, cortisol, stress, seeking dopamine from attachment figures, feeling abandoned instead, more toxic stress, more change in the brain architecture, behavioral reactions, more trauma. So advocacy that heals is recognizing that incarceration causes or re-traumatizes both the adults and the children. In Freeing Tammy, a wonderful book by Jody Raphael, Tammy talks about cutting off her relationship with her 10-year-old son because the cavity searches after the contact visits were traumatizing her so much, re-traumatizing her, reacting the sexual abuse trauma, that she was dissociating, and she wasn't eating, and she was getting in trouble in her unit. So she just said the best thing is not to have contact visits. There's something wrong with her having to make that decision. The Bill of Rights that I mentioned for children of the incarcerated is a framework as I close, and it's available through the San Francisco Partnership. It says, and by the way, kids don't have these rights, but we should be working to get them these rights. To be kept safe and informed at the time of their parents' arrest, to be heard and considered when decisions are made about them or their parent. And that means that judges might consider that this is a young child whose attachment disruption would cause trauma and not take the parent so far away, or perhaps consider probation or early parole in some cases. To be well cared for in my parent's absence, which also means helping the incarcerated parent to care for their child from prison. To speak with, see, and touch my parent. To support as I struggle with my parents' incarceration. Not to be blamed, judged, or labeled, and the ability to have a lifelong relationship with that parent. So we at the Resource Center are trying to disseminate information that's accurate, that really helps people advocate well. We want to train, inspire, and prepare, and connect people like you that are out there doing the work, and guide family strengthening policy, but most importantly, include the families in not only defining the problems, but designing the solutions. You know, we talked about the false bravado and the bragging about having an incarcerated parent, and it does happen a lot. But what happens more than that, I think, is the conspiracy of silence. It's the sense that children have of having to keep quiet. I came across this quote in a fortune cookie. I was struggling to write a speech, and I was in my 4th hotel in 5 days, and I was eating my takeout Chinese, and I couldn't think of an opening line, and boom, there it was. Silence and distance is uncomfortable, mostly when there's too much to be said. Once we have learned to speak of what is important to us, we will find beauty in silence and growth in separations. We have to be able to provide a framework for people, for children and adult children, to tell their stories, just like our panel today, and to tell their stories, telling truth to power, telling the stories in ways that are going to make a difference, not, as one of my colleagues says, to be just included as the warm-up act or the sad story or the example, but to really include the children and their caregivers and their incarcerated parents in all of the task force initiatives, in all of the writing, in all of the research. Only then will we be able to break the silence and really make the kind of the ubiquitous change that we need to make. Thank you very much.
I want to thank Ann again for that wonderful presentation and for putting some meat onto the bone of the discussion from earlier, as she put it. And what we'd like to do in the second half of the day, for those of you who have signed up, and for those of you that haven't, we welcome you. Please just see the attendance at the front of Alumni Hall. That we'd like to, and this is what the Planning Committee had wanted to do, and this is what we'd like to do at the Institute in our efforts regarding children of incarcerated parents is make sure that this bubbles up from the ground, that it's the children, it's the families, it's the communities that are hardest hit that are the ones telling the policymakers what should happen, which I don't think has often been the case in a lot of criminal justice policy, but we want to certainly, in our little way, help to make that happen. So that's how the second half of the day is. We're addressing it. We're having regional breakouts. We'll explain that a little bit more during lunch. We were going to have Q&A, but Ann is actually on the last panel. So if you think any questions and you can get them to me or someone else in our staff, please do so, and I'll try to address those in the final panel.